Health is a fundamental human right. Everyone deserves to live a healthy life, regardless of age, gender, and religion. Today is World Health Day, celebrated annually every April 7th, to raise awareness about health related issues and advocate for improvement in global health. World Health Day carries particular significance as nations strive to overcome global challenges in COVID-19 and emerging health concerns. Spectrum Television is out to get physicians to commemorate the day. Human pleasure and well-being are dependent on good health. Healthy people live longer and are more productive, which contributes greatly to economic progress. Equitable health not only promotes a sustainable economy, but also aids in the establishment of stable goals for future generations. Millions of people throughout the world suffer from a variety of terrible diseases. According to the World Health Organization, more than 13 million people die each year due to preventable environmental causes around the world. This includes the climate crisis, which is the world's single greatest health threat.
1. Resurgence of certain conditions which have been aided by climate change, environmental factors, and all of that. We are also looking at what are the causes of death amongst humans. Number one, cardiovascular diseases. We are seeing a lot of people die from complications of hypertension. Just see people collapse and die. Sudden death of cardiac origin. We are seeing a lot of heart attacks. We are seeing stroke. We are seeing heart failures. We are seeing cardiac arrest. So when you put all of these together, we call them cardiovascular causes of death, and they constitute number one on the charts of causes of death globally. And the second one is cancer. So for cardiovascular problems, the way out is for patients to be conscious of their conditions and then take their medications appropriately. Visit the hospital whenever appointments are given, because you see people who are hypertensive and they are living a normal life. They are enjoying themselves. Why? Because they obey doctors' instructions, they take their medications, and they live a healthy lifestyle. They avoid certain things that are injurious to health, like smoking, excessive alcohol intake. They avoid sedentary lifestyles. You see them going for physical activities, they carry out exercises. They eat well. You don't eat junks. By the time you eat well, you are able to keep pace with what your body needs, and you can avoid certain things. So the call to action to individuals is that they should be conscious of their health and they should listen to doctors' instructions. I will always advise that once you have been diagnosed of certain things, you should have a personal doctor, somebody you can call even at midnight for intervention. So somebody who knows your medical history and can act at any point in time. So people should be very conscious that instead of resorting to self-help, instead of resorting to taking all manners of supplements, and these supplements are very expensive. They abandoned drugs that were given to them in the hospital just to indulge in self-medication. Or somebody told me this helps work for him, or let me try it and all of that. So they should avoid it. For cancer, breast cancer is the number one cancer in the world now. So and it's affecting the younger age group. Before, we used to say that breast cancer is rare in females below 18 years. But now, the age range given by World Health Organization is from 18 years to 72. So even an 18-year-old girl should be conscious of her breast, what is happening there. And if she notices any lump or pain, she'll rush to the hospital for evaluation. So breast cancer is number one. What do we do about it? Young girls should avoid certain behaviors. Use of contraceptive pills should be limited. Okay? You even see women who have stopped menstruating, but they will go and get drugs called hormone replacement therapy to start living like young girls all over again. Those drugs will help them, but they will come to the breast and cause more problems. The role of the patients, the role of the members of the society, they should be conscious and then take doctors' advice.
Reports say millions around the world lack access to quality healthcare, education, and essential resources for a healthy life.
Everybody has the right to be able to access quality healthcare. The right to access quality healthcare is everybody's right, and that is the basis for the universal health coverage. That everybody everywhere will be able to access the health services that they need at prices they can afford, and hopefully not out of pocket, at the time they need it. What usually happens now, what obtains now in Nigeria, for instance, is that you or I or anybody else falls ill, then you go to the hospital, and at that point, if you haven't been going to hospital regularly, you will register, right? You get your card, you get, whatever it is, before you get to see the health professional, whether it's the doctor or the nurse in charge. And then after that, you'll be charged for the medicines, and then most times you're bringing it out of your pocket. But that is not that does not speak to your right of health, you understand? So first of all, is the access. Do you have the money at the time to access healthcare? If you don't, most people are going to sit at home, isn't it? That's one of the factors. Or if you don't have the money to pay, you won't just sit at home, you go and look for whatever is available closest to you. And that can be a whole gamut of all sorts of things. I've heard people saying, I went to the chemist. I'm not putting down chemists, but that really shouldn't be your first port of call. And it's just because of the access. They don't have the financial access to health services. And that is what I believe that WHO is trying to bring up in this reminder. Now, interestingly, the World Health Day, as celebrated, globally, is just like a reminder of, when the World Health Organization was established. I think that's the date that they were established. But each year, a theme comes up to remind us of key things. So today we're talking about access and rights to healthcare. So your question was about how the factors there. So this is one of the factors, the finances. The financial access. The other access, I like to think of access not just in terms of do you have the money to pay, but is there a functional health facility that you can go to? That's another access. Where the health facilities are not available, that is an issue. Where the health facilities are available and yet cannot provide the basic minimum healthcare package that the individual needs, that would be an issue, right? And then where the health facility is available and maybe the equipment might be in place, like the basic investigations in the side lab. And I'm talking at primary healthcare level. So while that might be in place, what about the healthcare workers? So that's another factor. What about the healthcare workers? Are they in adequate number at the facilities that people have access to or are supposed to have access to? So these are some factors. And I just like to think about the factors that would prevent adequate healthcare in terms of access.
Also, the right to health of billions is increasingly coming under threat. Despite progress in vaccination efforts and containment measures, the COVID-19 pandemic, mental health awareness, non-communicable diseases such as diabetes, cardiovascular conditions, and cancer remains leading causes of morbidity and mortality worldwide as it continues to pose challenges to global health. On World Health Day, individuals, communities, government, and organizations are encouraged to take action towards building a healthier future.
That's step one. The right policies need to be in place. The right policies, so that we have this general coordinating mechanism that ensures that whatever goes on at the primary healthcare level is being overseen properly. All the elements are not scattered around as they used to be. Under Local Government Service Commission, under State Ministry of Health, they were handling some primary healthcare services. Under maybe Ministry of Local Government, Ministry of Women's, everybody had a little bite, even wash services. But with these agencies, now like an umbrella, that everything should be brought together under one management. So there's one plan and then there's one monitoring and evaluation. So we call that the 3 1s. And so policy is very important, obviously. And then after the right policies are in place, is the political will to implement or to support the implementation of those policies. And that's why I said at the beginning that we're still unpacking what it means, what it truly means for all of these services to be under one roof.
The World Health Organization Council on the Economics of Health for All discovered that at least 140 countries recognize health as a human right in their constitution. Yet, countries are not passing and putting into practice laws to ensure their populations are entitled to access health services.
The way I see it is that the implementing partners are complementing. They're complementing, they're supporting, so that we don't fall back to, they're doing their thing. They understand. They just come into your states. And ever since the agency was established, we've tried to ensure that all development partners that are in the states, including WHO, UNICEF, and even the smaller implementing partners that are funded by these ones, that they come in and bring everything that they think they have for the state to the table, so that they are supporting, they're in the complementary role as opposed to the state governments being the complementary. That means we take ownership. When you take ownership, you put in the right governance in place. When I say governance, it's not the government, it's oversight of the things that you're doing. We understand. You ensure that, okay, if we say in the state, we want to ensure that all children under 5 get immunized. We have decided in the states that immunization is a good thing. So let's ensure. So if it comes from that angle, if it comes from the top in the states, then any partner that comes in and says, we want to support immunizations, then yes, we have that in our state strategic health plan. Do you understand? And this is where you can fit in. So they're now complementing what we do. My call to action for government is to ensure that the right policies are in place. No man is an island. You don't know everything. And COVID-19 taught us that no man is an island. When the lockdown came, everybody was locked down. Nobody could run off somewhere and get their own private medical care. What affects one affects the other. We're now a global village. So you can get good ideas or good ways of doing things from others. So you keep your eyes, open, but you select and sieve out those that are relevant to your own people. Because that's really the mandate, that when you come on board, you have to serve the people. You have to serve the people and make sure that there are things that are in place that for posterity, people can ride on that. So it's about putting the right policies in place in the light of what is going on globally. Do you want to have an outbreak of yellow fever in your state? Of course not. Nobody sets out to govern a state and say, that's what I want. No. I want to ensure that my people have proper health care. So what will give them access to proper health care? So the call to action is ensure the right policies are in place. Ensure the right mechanisms are also in place. For instance, remember I talked about access. That access is not just oh, I can't get there, but I can pay for the services when I get there. Do you understand? And every other thing that goes with it. So paying for the services, health financing. Other countries that have done well with healthcare have relied a lot on health insurance. And that's a major thing. That when you go there, it's not your wallet, the money in your wallet that is going to pay, but it's the money that you've been contributing to over time that will help save the day.
Meanwhile, the theme for this year's commemoration is My Health, My Right, which was chosen to champion the right of everyone and everywhere to have access to quality health services, education and information, as well as safe drinking water, clean air, good nutrition, quality housing, decent working, environmental conditions, and freedom from discrimination. As we observe 2024 World Health Day, it is often said, health is wealth. Let us reaffirm our commitment in building a healthier and resilient world. Together we can create a future where health is not a privilege but a right enjoyed by everyone. Wang Fon Walter, Spectrum Television.